Amanda.
Hi.
Can you please introduce yourself for our viewers?
Yes, I'm Professor Amanda Howe. I'm about to become the president of WONCA, which is the World Organization of Family Doctors. Family doctors are a community of specialist doctors who work in the community, with the community, doing prevention, acute diagnosis, chronic care, palliative care, just trying to really help the people to be healthy and stay healthy.
And what are your plans for when you become president of WONCA?
Okay, so our mission in WONCA is to help to develop the specialty of family medicine all around the world, because we think it helps a really good health system for the people. And so everything we do is to try to encourage good training for young doctors in family medicine, residency schemes, presence in the medical school, and then when they become family doctors, to support them in the community. And my particular priorities for the next 2 years are to keep that leadership going, so that we're always thinking ahead. How can we do better? What is the new research for our discipline that we must bring into the practice? How to support the doctors and the clinical team, the nurses, the community workers. We also want to make sure that we look after our members. So another priority is the engagement and the support for the doctors, because many of them do a very hard job, a very demanding job, a very big professional commitment, so we want to support them too. And then we're very concerned particularly about the more needy patients, because sometimes, the richer areas gets a good service, but a poor area in a city or a poor rural area or a poor country, family medicine may not be so good. So we're particularly I am interested for my presidency in equity. Can we reach the vulnerable populations? The people who are in a conflict zone all around the world. We see so many people in trouble because of war, and we're particularly committed to trying to support our colleagues there to get the resources they need to help the people. These are some things we will do.
Yes. And do you know the system in Brazil, the health system in Brazil?
Yes, I was privileged to come to Rio 2 years ago when we were setting up this wonderful conference. And so at that time, I met many of the residents, and I went to one of the new favela clinics. So I saw the young doctors working there with this very good system where the population everybody has a clinic, and they have a link worker into the clinic so that they can do good education and prevention. And I was very, very impressed. So I know a little bit about it.
Thank you, Amanda. Thank you for your time.
It's okay? Bravo. Thank you for asking me. Well done.